اليوم راح نكمل محاضراتنا Pharmacology. Today we're speaking about drug receptor interaction and pharmacodynamic. اليوم راح نتكلم عن pharmacodynamics. خلصنا pharmacokinetics في المحاضرات السابقة. اليوم راح ناخذ الجزء الثاني من pharmacology which is pharmacodynamic. And أيضا راح نتكلم عن drug receptor interactions. بسم الله الرحمن الرحيم. Pharmacodynamics describe the action of the drug on the body and the influence of the drug concentration on the magnitude of the response. إذن هو تأثير للدراجز على الجسم على البادي. The action of the drug on the body. Most drugs exert effect both beneficial or harmful in case of side effect drug by interacting with a specialized target molecule called receptor. Then, of course, there is a specialized target molecule which is called receptor, which are present on or in the cell. The drug occupied in this place. The drug receptor complex راح يتكون عندنا drug receptor complex initiate alteration in biochemical and or molecular activity of a cell by a process called signal transductions. Then to each drug to induce its effect, it has to occupy on its receptor. And there is a receptor inside our body for each drugs or each molecules. Okay? This will composed or consist of the drug receptor complex. Drug receptor complex. So some definition we have to know before we enter to this subject, which is what is receptor? Receptor, any biological molecule to which a drug binds and produce a measurable response. Could be this biological molecule could be enzyme, nucleic acid, structural protein. Also, we will hear about second messenger. What is second messenger? Part of the cascade of events that translate ligand binding into a cellular response. What is ligand? Ligand, a small molecule that binds to a site on a target protein. So, ligands, which is small molecules, صغيرة موجودة bind on the target protein. Also, there is another definition, we will hear it, affinity, which is the strength of the interaction or binding between ligand and its receptor. So, there is interaction or binding between the ligand and the receptor. What is ligand? A small molecule that bind to a site on a target protein. So, receptor, it's any biological molecule to which a drug binds and produce its effect. Could be drugs, could be enzyme, this could be nucleic acid, any chemicals molecule. What is signal transduction? Signal transduction, the process by which the drug receptor complex initiate alteration in biochemical or molecular activity of the cell. If you ask ourselves how this alteration could be happen. For example, this is the receptor. For each receptor, there is special place to the drug or any molecule to occupy on this receptor. Here, we call it this domain or the place. It's unoccupied receptor. It's empty, unoccupied receptor, so does not influence intracellular process. Here there is no any process because this place is not occupied with any drug or molecule. Here, when the drug, for example, patient administered his drug, this drug normally when occupied on the receptors change physical and chemical properties which lead to interaction with cellular molecules to cause biological response. So it should be the drug should be occupied on its receptor So there is chemical and physical change here, and there is interaction cellular molecule, and this will cause biologic response. This will cause biological response. So drug receptor complex in drugs plus receptor give us drug receptor complex. Then when this complex initiate, it will give biological effect. Receptor so the receptor are specific for the ligand they bound. Each receptor are specific to the ligand they bound. And receptor exists in either an inactive state, which call R, or activated state, R with the star. This is the activated form of the receptor. This is the inactivated form of the receptor. Binding of a ligand to a receptor can cause the receptor to change from an inactive state to an active state. The activated receptor interact with other molecules to produce the biologic effect. So this is how produce the biological effect. So when the ligand interact with the receptor, it's confirmed the inactive form of the receptor to inactive state, which it give us the biological effect. There is actually four receptor families, four kinds of receptor families: ligand-gated ion channel, G protein coupled receptor, enzyme-linked receptor, and intracellular receptor. We will talk about each one separately in a briefly way. So the type of receptor a ligand, the type of a receptor a ligand interact will depend on the ligand's chemical nature. And there is four type of receptors family. This graph will show the four different types of receptors family: ligand-gated ion channel, G protein coupled receptor, enzyme-linked receptor, and intracellular receptor. And here a ligand bind to A, or ligand-gated receptor bind to extracellular domain of a ligand-gated channel. B, G protein receptor here ligand bind to a domain of a transmembrane receptor which is coupled to G protein. This is the G protein, which is different shape. C, ligand bind to extracellular domain of a receptor that activate a kinase enzyme, which is enzyme-linked receptor, while intracellular receptor lipid-soluble ligand diffuse across the membrane to interact with its intracellular receptor. This is briefly the four families of receptor. We speak with each one separately. For transmembrane ligand-gated ion channel, the extracellular portion of ligand-gated ion channel contain a drug binding site. Okay, this site regulates the opening of the pore through which ion can flow across cell membrane. The channel is usually closed until the receptor is activated by an agonist, which opens the channel for a few milliseconds. These receptors mediate diverse functions, actually including neurotransmission and muscle contraction. For example, stimulation of the nicotinic receptor by acetylcholine opens a channel that allows sodium influx and potassium outflux across the cell membrane of neurons or muscle cells. So this is the ions to occupy. This is the ion. When these four channels is open, the ion influx inside the cells across the membrane. And for each, for example, when neurotransmitter binds, or there is a special site to occupy on it. On the extracellular portion, ligand-gated ion channel. The next type of receptor, transmembrane G protein coupled receptor, and there is the different sorry, different shape of G protein coupled receptors. The extracellular portion of this receptor contain the ligand binding site, and the intracellular portion interact with the when activated with G protein. Okay, there are many kinds of G protein, for example, GS, GI, and GQ, but all types are composed of three protein subunits. And the alpha subunit bind, for example, bind guanosine triphosphate, and beta and gamma subunit anchor the G protein in the cell membrane. This response, G protein coupled receptor, usually lasts several seconds to minutes. Several seconds to minutes. So the time difference between each kind of receptors family. Number three, enzyme linked receptor. This family of receptor undergoes conformational change, that means shape change. It will change the shape of the receptor when activated by a ligand, resulting in increased intracellular activity. This response lasts for minutes to hours. The most common enzyme linked, or the most common example for this enzyme linked receptor, growth factor and insulin versus tyrosine kinase activity. These processes, the enzyme linked receptor often cause a signal cascade effect like that caused by G protein coupled receptor. So here in this case, the receptor is an enzyme. For example, receptor for insulin and virus growth factor have tyrosine kinase activity. The receptor directly activate an enzyme. And an example, the receptor for growth hormone and various cytokine activity, a peripheral membrane protein that is a tyrosine kinase. So here, for enzyme-like receptor, single molecule in form of a dimer, it will occupy on the receptor and change the shape of the receptor. This is inactivated target. This is active domain. This is inactivated domain. So it changes the shape or conformational change on the receptors. For example, for this growth hormone and insulin, this process lasts for minutes to hours. The fourth kind of this family, which is intracellular receptor. This is the fourth family of receptor, differs from the other three in that the receptor is entirely intracellular. Here the receptor is intracellular, not extracellular. Therefore, the ligand, for example, steroid hormone, must have sufficient lipid solubility to diffuse into the cell to interact with the receptor. So it should be, because it's an intracellular receptor, the molecule should be lipid solubility to enhance its induced inside the cell to interact with the receptor. The activation or inactivation of the transfer here, for example, this receptor is special for nature molecule. For example, the activation or inactivation of transcription factor alter the transcription DNA into RNA and subsequently translation of RNA into protein. This is an example of intracellular receptor. Actually, the effect of this receptor take hours to days to occur. Hours to days to occur. So it is intracellular receptor. The molecule should be lipid soluble to enter inside the receptor. Now we are talking about dose-response relationship. Dose-response relationship. So after the drug enter inside the cell and enhance its effect, we're speaking about that. Now we're speaking about dose-response relationship. A graded dose-response relationship. graded dose-response relationship. As the concentration of a drug increases, its pharmacology effect also increases. So the response is gradual and continuous. Two important drug characteristics we have to know, which is potency and efficacy. These two important definitions we have to know and determine. Potency and efficacy can be determined by graded dose-response curve. Potency and efficacy. Potency is a measure of the amount of a drug needed to produce an effect of a given magnitude. So it is the amount, the concentration of a drug needed to produce an effect to given a magnitude. EC50, the drug concentration that shows 50% of maximal response. Okay? Efficacy, it is the ability of a drug to produce a response when it interacts with the receptor. So potency is the concentration or amount of a drug needed to produce the effect, while efficacy, the ability of a drug to produce a response when it interacts with a receptor. Here we have an example. For example, the EC50 for a drug A and B indicate that the drug A is more potent than drug B because lesser amount of drug A is needed to obtain 50%. Lesser amount of the drug A is needed to obtain 50%. Therapeutic preparation of a drug reflects their potency. For example, candy, sartan, and sartan are angiotensin receptor blocker used to treat hypertension. The therapeutic dose range for sartan is 4 to 32 mg, as compared to 75 to 300 mg of irbesartan. Therefore, candesartan is more potent than irbesartan. That means it has a lower EC50 value. So, the EC50 value is the concentration of the drug that produces a response equal to 50% of the maximum response. The potency of a drug can be compared during using the EC50. The smaller the EC50, more potent of the drug. As long as smaller EC50, that means more potent of the drug. More potent of the drug. That means here, as we say, drug A and the drug B. The drug A more potent of the drug B. Why? Because a lesser amount of drug A is needed. That means E50 is smaller than E50 of drug B. Now we're speaking about agonists and antagonists. Agonists and antagonists. What is agonist and what is antagonist? Agonist, an agent that can bind to a receptor and produce a biologic response, which agonists usually mimic the action of the original endogenous ligands on the receptor. Example, norepinephrine on beta-1 receptor of the heart. Agonists stabilize the receptor in their active state. The magnitude of the drug effect depends on the concentration of the drug at the receptor site, which depends on the dose of the drug administered and the rate of the drug ADME, which is absorption, distribution, metabolism, and elimination. So agonist is an agent that bind to a receptor and produce biological response. And this agonist, it will mimic the action of the original endogenous. The effect of the agonist depends on the concentration of the drug, which is depend on dose of the drug and ADME. Agonists, there are three types of agonists. Could be this agonist, full agonist, or partial agonist, or inverse agonist. And we will speak about each one separately and briefly. There is a full agonist, partial agonist, and inverse agonist. Full agonist, a drug that binds to a receptor and produce maximal biological response that mimic the response to the endogenous ligand. Full agonist has a strong affinity to the receptor and good efficacy. Partial agonists have efficacy greater than 0 but less than that to a full agonist. It has an efficacy greater than 0 but less than that of a full agonist. Partial agonists cannot produce an Emax of as great a magnitude as a full agonist. So the efficacy of the partial agonist is not that as of full agonist. The affinity of partial agonist might be greater than or less than or equal to a full agonist. Partial agonists may act as antagonists of full agonists. Sometimes partial agonists could act as antagonist of the agonist if it is in a large dose. Here, this graph just show effect of partial agonist, effect of partial agonist, response provided by the partial agonist, a high concentration of partial agonist, the agonist is completely displaced, and receptor activity is determined by the intrinsic activity of partial agonist. This is here the same graph, but I biggerized it. Here is the response provided by the full agonist. Look to the response provided by full agonist, and which is with the partial agonist is different, and in the red color, which is the total response. Total response. The presence of partial agonists displays some agonists, resulting in diminished receptor response. Another type of agonist, which is inverse agonist. Inverse agonist. Which here stabilize the inactive receptor state. This decreases the number of activated receptor below that in the absence of the drug. Inverse agonists reverse the activity of receptors and produce the opposite pharmacological effect of a full agonist. It produces opposite of the pharmacological effect of a full agonist. Here is the same pictures of that, but in bigger way. That means a full agonist produce complete activation of a receptor at high drug concentration, while partial agonist binding results in less than 100% activation, even at a very high concentrations. Inverse agonist reduces a response below the baseline response measured in absence of a drug. These figures show effect of full agonist, partial agonist, and inverse agonist on receptors activity. Now another definition, which is antagonist. Antagonist. Antagonist drugs an agent that decrease or opposes the actions of another drug or endogenous ligand. They are bind to a receptor and block its physiologic response. They are block the physiological response of the receptor. For example, antihistamine drug, which is used for allergy, it is block the histamine receptors. There are two types of antagonists, competitive antagonists and irreversible antagonists. Competitive antagonist, which is an antagonist that binds to the same site on the receptor as the agonist. So it is competitive with the agonist. It is bind to the same site on the receptor as the agonist. Which need to prevent an agonist from binding to its receptor and maintains the receptor in its inactive state. The effect of competitive antagonists can be overcome. How? By adding more agonists. By adding more agonists. Here, it will increase the EC50 of the drug. It will increase the EC50 of the drug because we had to adding more agonists. That means increase the concentrations of the drugs. We need to increase EC50. So the competitive antagonist compete with the agonist on its side, on its receptor, preventing it to induce its pharmacological effect. But this effect, the competitive antagonist, can be overcome. How? By adding more agonists. Irreversible antagonist, it is not competitive, cannot be overcome by adding more agonists. The mechanism, the antagonist bind covalently or with high affinity to the active site of the receptor, reducing the amount of the receptor available to the agonist. The antagonist bind to a site, which is allosteric site, preventing the receptor from being activated even when the agonist bind to the active site. Example, here is a competitive versus non-competitive antagonist. Here, the drug alone. The drug with competitive antagonist, which is move the curve with the right side. The drug with competitive antagonist. For example, the antihypertensive drug tyrosine compete with the endogenous ligand norepinephrine at alpha-1 adrenal receptor, thus decreasing vascular smooth muscle tone and reducing blood pressure. However, increasing the concentration of agonists relative to antagonists can overcome this inhibition. Thus, competitive antagonists characteristically shift the agonist dose response curve to the right. That means increase in EC50 without affecting Emax, without affecting the efficacy. So this graph shows the effect of a drug antagonist. EC50 for a drug in the presence of a competitive antagonist, it will be increased. EC50 for a drug alone or in the presence of a non-competitive antagonist. Look here, the area for EC50 for a drug in the presence of the competitive will be increased, but this will not affect Emax. That means the efficacy. It will affect the potency, it will not affect the efficacy. The antagonist, it has also another kind of antagonist in addition to competitive antagonist, a reversal antagonist. There is also what is called functional antagonist, chemical antagonist, and pharmacokinetic antagonist. Functional antagonists causing effect functionally opposite than those of the agonist, while acting at completely separate receptor than the agonist. Chemical antagonists prevent the action of an agonist by modifying or sequestering the agonist so it's incapable of binding to and activating the receptor. Pharmacokinetic antagonists reducing the active drug concentration, for example, when the drug absorption is decreased or the metabolism and renal excretion are increased. Another definition, which is the last definition we have to know in this lecture, which is the therapeutic index. Therapeutics index, abbreviation of it is TI, therapeutic index. Therapeutic index of the drug is the ratio of the dose that produce toxicity to the dose that produce a clinically desired or effective response in 50% of the population. So therapeutic index is TD50, ratio between TD50 and ED50. TD50, the drug dose, the drug dose that produce a toxic effect in 50% of the population, while ED50 is the drug dose that produce a therapeutic effect in 50% of the population. So, therapeutic index of the drug is the ratio of the dose that produce toxicity to the dose that produce clinically desired or effective response in a population of individuals. Actually, therapeutic index is useful in a measure of a drug safety. So it is determined by measuring the frequency of a desired response and toxic response at various doses of a drug. There are a neurotherapeutic index drugs, for example, warfarin and digoxin, as an example of a large therapeutic index drug. That means more safe to use because there is a large area. It is, for example, penicillin. So this is the same graph in the next slide. Give an example for a small therapeutic index and large therapeutic index. This graph shows cumulative percentage of patients responding to plasma level of warfarin and penicillin. Here, therapeutic window for warfarin. There is very small area. There is a desired therapeutic effect. There is very the effective and toxic concentration dose of warfarin are closer. That means the therapeutic index is very low. While the effective dose and the toxic dose of penicillin is not closer. There is a large area for therapeutic, so it is more safe, and we call for it large therapeutic index. Look, this is large window, not a narrow window for therapeutic. This is for warfarin as an example for small therapeutic index, while for penicillin, large therapeutic index. For example, most likely to occur with a drug showing neurotherapeutic index. Sometimes there is variation in patient response, which is more likely to occur with a drug showing neurotherapeutic index because the effective and toxic concentration are closer. Agent with a low therapeutic index, that is a drug for which dose is critically important, are those drugs for which bioavailability critically alters the therapeutic effect. While in case of penicillin, for example, drugs such as penicillin, it is safe and common to give doses in excess, often about 10-folded excess of that which is mimically required to achieve a desired response. In this case, bioavailability does not critically alter the therapeutic or clinical effect. That's what all we have for pharmacodynamic. Thank you for listening, and I'm ready for any questions. Thank you.